Welcome to the image analysis of the AP scapula projection, AP and lateral, sorry. Let's start with the AP projection. Image analysis guidelines state that the anterior and posterior margins of the glenoid cavity are nearly superimposed. The lateral scapular border should be seen without thoracic cavity superimposition, while the thoracic cavity is superimposing the vertebral border. The superior angle of the scapula are seen without clavicular superimposition. The humeral shaft should be demonstrated at 90 degrees of abduction. The scapula is demonstrated without longitudinal foreshortening. The superior scapular angle is slightly inferior to the clavicle. The midscapular body is at the center of the exposure field. The scapula is included within the exposure field. The scapular structures situated in the thorax demonstrate adequate contrast resolution. I want to also note that the patient's shoulder should be retracted, meaning almost flush against the IR to decrease any scapular body foreshortening. Also, if there's poor retraction, the degree of glenoid cavity visualization will actually increase, and we pretty much want the borders almost superimposed in that glenoid cavity. So when taking this projection, you want to make sure that the shoulder is retracted to the IR and we are at a 90 degrees of abduction. Let's take a look at our first practice analysis of the scapula. You're always going to evaluate for any rotation. You're always going to evaluate if we have any mid-coronal plane tilting or any of those things as well. But first, in this projection, we want to just determine, do we have the anatomic structures? Well, I do identify a scapula on this projection. However, are we positioned appropriately? And the answer to that question is no. We have no humeral abduction in the 90 degrees from the torso. The reason I know this is the position of the humeral head and arm, as well as the lateral border of the scapula is superimposing the thorax when this medial border should only be demonstrated on the lateral border of this thorax. So we need to abduct that arm towards that lateral border so that we can get that scapula in profile here. Let's move on to the lateral projection of the scapula. Image analysis guidelines for the lateral projection of the scapula state the superior scapular angle should be demonstrated just inferior to the clavicle. The longitudinal scapular body is demonstrated without foreshortening, and the superior scapular body is seen without overlap of the humeral head and or glenoid cavity. The scapular body is in a lateral projection with superimposed lateral and vertebral scapular borders. The midscapular body is at the center of the exposure field, and the entire scapula should be included in the exposure field. Here are those image analysis guidelines for your review. And again, for whether performing a scapular Y or a lateral scapula, the same analysis tips and tricks can be utilized to determine insufficient rotation or excessive rotation. In insufficient rotation, you need to identify which is the lateral border. The lateral border is always thicker than the medial border, and in this first projection you can tell that it's an insufficient rotation because the lateral border is away from the torso, the glenal cavity moved away from the torso, and the medial border is superimposed the thoracic cage here. So we need to increase rotation. And excessive rotation in this second projection, you can see that you want to identify that lateral border again, which is the thicker border, and it is superimposing the thoracic cage, and that glenal cavity is superimposing that thoracic cage, which should indicate to you excessive rotation. Now I know this is a scapular Y projection, but the rules will apply to a lateral scapula as well. So let's take a look at this lateral scapular practice analysis. In this projection, we want to determine if we have all the anatomic structures that we need. And we do have a scapula in this projection. Next, we want to determine if there's any rotation issues or any positioning issues. So first we want to look at the borders of our scapula, the lateral and medial borders. Are they superimposed? And no, they are not. The lateral border, which is the thicker one here, and is not superimposed by this medial border, which is right here. When the medial border is closer to the thoracic cage here, that means we are insufficiently rotated. We're going to need to repeat this image and increase the degree of patient obliquity. In addition, we are looking at the scapular body here, and so we're going to need to adduct the humerus to more of a 90-degree angle with the torso so that we can get the patient in the appropriate position to look at this scapular body and get that superior scapular angle where it should be in alignment to the coracoid to get a quality image. This concludes the image analysis for the scapula presentation. If there's any questions, please feel free to reach out to me via email or at clinic. Thank you for participating.